should our priorities be in Congress to improve the nation's readiness for a future health emergency?
Well, thank you for that. I think a partnership with Congress is so important. We've talked a lot about needing the resources and authority to be the national security asset that we need, but I'll also say it's really important that we align to share good information about tools folks can use to protect themselves. We know that folks want to leave COVID in the rearview mirror, but it is still here with us, and it is important to have a shared voice saying, hey, use these tools that are safe and effective. I'm certainly going around the country doing that. I'd love to have more voices join that chorus. But again, the communication is important, but we need those resources and authorities that allow us to do our job well.
And some of our Republican colleagues have raised concerns about CDC's Federal Select Agent Program and CDC's inspection of a facility in Reedley, California. Can you explain the role of the Federal Select Agent Program in biosafety? And is there anything you would like to clarify on the CDC's response to reports about the Reedley facility?
Well, thank you, Representative Ruiz. You know, the report that was put together on this did have a number of inaccuracies, and I do want to make sure we're clarifying that the investigation was run by state and local officials in California. It was run by FDA, FBI. CDC was brought in, to your point, around select agents. We were asked to join on site to investigate, could there be select agents on site. Our team was there for 2.5 days in an extensive review, took hundreds of pictures. We looked at invoices, we looked at freezers, and what was actually very notable was the absence of equipment that you would normally see if there were select agents. So whether it was protective equipment or safety hoods or what have you, none of that existed at this lab. And after that extensive review, you know, our team did conclude that there were no select agents on that property, and then again turn the investigation back over to the FBI and others who were in charge.
Thank you. You know, we face challenges in rural and underserved communities in getting public health information to them. What are some of the most persistent obstacles the CDC faces in getting public health information to hard-to-reach communities, and what strategies does CDC employ to try to overcome these obstacles?
So it is very important that we are reaching every community. I believe no matter what zip code you live in, you should have the opportunity for health. I think our most important tool here is partnership and trusted partners. So there are trusted partners that we work closely with who already are known by their community, trusted by their community. And again, we're focused a lot also on making sure our health providers have the information and tools. We know that they're trusted, doctors and nurses, and those are folks that we want to make sure we're partnering with.
Thank you.
Thank you.
Thank you. And now I call on myself for 5 minutes of questions. Thank you, Director, for coming to testify, and thank you for meeting with me in my office the other day. In addition to this committee, I also serve on the Select Subcommittee on the Coronavirus Pandemic. The CDC is obviously important to the health and safety of Americans. And unfortunately, I think all of us know that the confusing and inconsistent recommendations coming from the CDC during the COVID pandemic have really damaged Americans' trust in the CDC, and we want to rebuild that. Vaccine and mask mandates implemented by the Biden administration and states have caused long-lasting distrust in the trust us, the government knows best what's for you mentality. I have been told that while you served as the Secretary of the North Carolina Department of Health and Human Services, you were a staunch proponent of vaccine mandates, extending school closures, and business lockdowns and closures. Is what I have been told accurate? And if so, how do we know you won't support government mandates at the federal level?
Well, Thank you, Representative Lesko. And, I appreciate that we're looking forward. We want to turn that new chapter. I think there are a lot of lessons learned from the pandemic. We've been talking about them today. And you have to remember, at different moments in time, we needed different solutions. And the good news is we are in a different place, and we can look forward as we go to make sure that we are building the national security asset that we need. And so we want to use tools that protect folks' health. Vaccines are a very important tool to protect folks' health. It's why I've been traveling around the country sharing that. But I am trying to take those lessons learned, apply them, and move us forward.
Well, hopefully you'll take those lessons if another pandemic breaks out while you're still the director. Because I oppose government mandates. I myself took the vaccinations, but I don't think it should be forced on people. And with that in mind, do you think that the government mandating vaccine mandates, it actually did the opposite effect and made people more hesitant to take them?
Well, I think vaccines are a critical tool to keeping folks healthy and safe. And it's not just the COVID vaccine, it's flu, it's all of the vaccines that have kept children and people safe for many, many decades. I think they continue to be really important tools. And I look forward to working with Congress to make sure that we can get good information to folks so that they can make the choices for themselves to use tools to protect themselves.
Well, I can tell you from personal experience talking to many constituents, the mandates actually had the opposite effect on people. Less people want to take vaccines. I think it's a better approach to encourage people to take vaccines, not to force it on them from the government, because then people just will distrust it. Not all people, but a lot of people. My other question is, do you believe that wearing cloth masks or the surgical mask, I'm not talking about the N95 mask, the surgical mask prevented people from getting COVID?
Well, thanks for that question. We know that masks work. They do work. The surgical masks work to make sure that you're protecting you, the individual, from circulating viruses. So they do work. And again, at different points in time, they were some of our only tools that we had before we had reliable tests or treatment or vaccines. But they are still a tool that we can use. But don't forget washing hands, ventilation. We learned a lot during the pandemic. We need to use all those tools.
So you believe that some of those cloth masks that people had, where the openings and the cloth is bigger than the molecules of the COVID vaccine, actually prevented people from getting COVID?
Well, so surgical masks are certainly better, and N95s go, even better than that. But cloth masks still provided some barrier to folks, but that's not, when CDC makes its recommendations about what kind of mask to wear, we say wear a well-fitting, appropriate mask, yes.
I hope that the government balances the benefits versus, for instance, in school children, having all school children mandated to wear masks when perhaps those masks benefit did not outweigh the negatives of children not being able to see lips moving or expressions and that type of thing. Thank you. Go ahead.
Oh, I was going to say that is where we relied on the American Academy of Pediatrics related to safety of masks for kids, and they continue to say that continues to be a tool that we can use to make sure folks are protecting themselves.
Thank you. And now I call on Representative Chakowski for 5 minutes of questioning.
Thank you, Madam Chair. I am so happy to welcome you, Dr. Cohen, at your first hearing right now, and I want to wish you the best of luck. And I want to also say that I am so grateful that you have hit the ground running. I know that you have been all around the country that you have been encouraging people to get vaccinated and that you have been fighting vaccine misinformation. I know that you were in my city of Chicago. I appreciate that very much. I have focused on older Americans and their health care needs throughout my career, and I am concerned about what is happening right now in nursing homes and in assisted living places, where we see, according to your agency, that in fact that the numbers of seniors who are right now being vaccinated is quite low. And in fact, there was a study that found that only 20% of the people in nursing homes right now have gotten the vaccines that they need. Before I turn to you, I just want to say that we also rely on staff. Mm-hmm. And the CDC does require staff to understand more about being vaccinated and to pass that on. But we are concerned that some of the staff are not encouraging people to get the vaccines. Could you reply to that?
Well, first, thank you, Representative Strakowski. We, too, share your focus on seniors and making sure that they are vaccinated. We continue to see in our data that those over 65 are at the highest risk of hospitalization and death from COVID, flu, and RSV. So it is important that folks are getting access to these tools. I want you to know that we have been very focused on engaging the long-term care community and leaders. We had a summit at the White House bringing folks together to understand barriers, and we continue to have weekly calls with folks to say, how can we help and overcome any challenges? And I have spent at my time as I've traveled around the country to visit some nursing homes, a particular few that have really high rates of vaccination, to understand what are those best practices that we can share around the country. I was in a nursing home outside of the Philadelphia area, Statesman Nursing Home, where they really used their love of the football Eagles to help them with their vaccination efforts, right? They made it a little fun because, look, we understand that folks are a bit fatigued from vaccines, and so by thinking about creative ways to get folks vaccinated, and I appreciate you bringing up the staff, because it is important for the staff themselves to get vaccinated. So we need to be working not just to get, of course, our vulnerable seniors, but also those who are working closely with them. So we have we have been working closely to make sure we're thinking about both communities to get vaccinated.
Thank you so much for that. In the remaining time, I wondered if you could tell us, looking forward, what your priorities might be. I'm not just talking about the issues that you want to confront, but perhaps also the management of the CDC.
Well, thank you for that opportunity to talk about the future. You know, I shared that we really need to make sure, again, that we are identifying and responding to health threats, that we are making sure that we're giving evidence-based but common sense solutions for folks to protect themselves. But I want to spend a little time on how we create a system that brings health delivery and public health closer together. I think silos were not our friend during the pandemic, and I'm working hard to make sure that we are bringing CDC and public health, state and local, closer to our health delivery system. Now, I want to make sure I don't lose the opportunity to talk about the importance of the public health workforce and needing people to be experts and do this work as we go forward. So making sure that we are training the next generation of experts in public health, but that does require us to continue to work with Congress to make sure we have the right authorities to bring in the talent that we need as we go forward. So a lot of work ahead to build an integrated way in which we're bringing health delivery and public health closer together, that we tie that together with data and other mechanisms, but we need the people who are the experts to make sure we can carry out our mission.
Thank you so much, and I yield back.
Thank you.
Thank you. And Dr. Bashan, just so that you know, our rules say that Mr. Peters has to go first. So I call on Representative Peters for 5 minutes of
I love going
questioning.
in front of Larry. Thank you, Dr. Cohen. I have to say, we had a really great conversation the other day, and I was excited about, I think I was frustrated with a lot of people about CDC's communication, and I'm very indulgent because I know that, gosh, we didn't know anything. We didn't have any tools, and I thought that throughout the whole process, looking back, it would have been useful to share more of the uncertainty along with people as we went along. I think they would have appreciated that. And I think you just made a mistake in this testimony in that I wanted a clear answer to a question, do cloth masks work? And you gave me an answer as a lawyer that I had a hard time understanding. And I think it's a fair question. And I guess I wish you had just said, don't use cloth masks, use the surgical masks. Don't we have enough information to answer the question like that?
Well, so I want to make sure that we are saying that cloth masks are a barrier, meaning that they do work in some, but do surgical masks work better? Absolutely, right? Would I wear a cloth mask? No, I wouldn't. I would wear a surgical mask.
It's still pretty complicated. And my district is, I think, the 10th best educated congressional district in the country. My neighbor would say, should I wear a cloth mask? I don't know from your answer of what I should tell them. What I would say is, I don't know what to tell them. So I guess I'm a little bit frustrated with this still a little bit unclear response from you about a simple question. But let me ask about a complicated thing, which is data. What would you tell my neighbor about the importance of having good data at the federal level to help us inform how to prevent something like this from happening again, or how to address it as it happens? Sure,
but I want to be clear. Wear a surgical mask. So wearing a well-fitting surgical mask. But on the data side, it is really important to have a national picture of what's going on. I think we've made a ton of progress in that way. I mentioned actually a new data visualization around our wastewater data. I think that is going to give us some really interesting look at some early signals about what's happening in communities all across the country. And the reason we need a national picture, I mentioned, I led the COVID response in North Carolina. Charlotte, one of our biggest cities, is on the border with South Carolina. It was really important for me as a public health official to understand what was happening in South Carolina to understand what would happen in Charlotte.
Back that up a couple steps. Why is that important? You say it's important. I think I agree with you. Why don't you explain why is it important for you to have information? And what information did you need to have to make a response?
Yeah, so having that information allows us to deploy different...
What information?
Depends on what we're talking about, whether it was how many people are vaccinated in an area, how many tests were we seeing people get access to. If I could see certain neighborhoods that weren't getting as much testing or as much vaccination, I could deploy at the state level different kinds of teams. We also had information, at the height of the pandemic where ventilator use was. And, that was an important point related to South Carolina, because there were multiple times where North Carolina had to share some of our ventilators with South Carolina. So knowing where our ventilators were and how we could be sharing resources was really critical.
So I've been long wondering what we could do in Congress to support better data at the national level. I know the administration has taken on a data monetization initiative. I think that's great. It needs to be funded. What is left to be done in that initiative, and what do you need from Congress in addition to funding?
Thank you for that. The funding is critical, and we want to make sure we're moving forward. But in terms of authorities, we have really scoped out something that I think allows us to do even a pilot is a step forward here. So we have some concrete language, and I'm happy to have our team share with you that we've been working on, particularly with some of our Senate partners, about how we can think about a data authority that allows for collection of data beyond COVID to make sure that we're getting the information we need to respond quickly, to your point, to deploy different kinds of tools based on what we see in the data.
Do you have legislative ideas for us that we need?
Absolutely.
Okay. Well, I'd love for you to share that with us. I think we all want to make this work better. I want to say again, look, we started this, we were really vulnerable as a country. We didn't have even PPE. We didn't have a lot of science. I think one of the ironies of this whole discussion is that one of the great achievements of the Trump administration was the warp speed creation of a vaccine really fast. They don't want to talk about it now because they're sort of anti-vaccine. It puts them in a tough spot, but I would like to know what positive lessons we can learn from that to make sure that we get that we're ready the next time. And I hope that you'll be very forthcoming about the funding needs you have, which will be smaller at the front end than they are in the middle. We lost a lot of, we spent a lot of resources dealing with this. I think that was the right thing to do in the circumstances, but let's make sure we're not caught unprepared next time and have to do that again. I yield back.
Now I recognize Dr. Bouchon for 5 minutes of questions.
Thank you, and thank you, Director Cohen, for being here today, and thanks for recently coming to the GOP Doctors Caucus. I very much appreciate it. Your job isn't an easy one. You knew that coming here, though, right? Yet you've taken on the challenge, and I have a great deal of respect for that. I want to quickly follow up on what Mr. Peters said about data. The key is making it clear to the American people this is de-identified, non-person specific data. That's the challenge I have in rural America. People just don't trust the feds on this, and we have to make sure that we do that. And I agree that we need better data. As I've discussed with your predecessor, Dr. Walensky, as a physician myself, political influence must be removed from the decision making at the CDC, and I've mentioned that to you at Doc Caucus. This has happened recently under both Republican and Democrat administrations. We're all aware that a substantial percentage of the public has lost trust in the CDC. And we can agree or disagree on how exactly that happened or what the implications may be, but I believe all of us looking forward can agree that something needs to change if the agency is going to be effective at combating the spread of communicable diseases, as was its original mission. Let me remind everyone the CDC was established in 1946 as the Communicable Disease Center, the CDC. It was born out of the goal of preventing malaria and typhus in southeastern states. The CDC has been the preeminent organization in the world on these issues for decades, and still is, in my view, even with the challenges created by what I consider overbearing political influence. With that statement, I want to talk about specific communication and how we communicate and convince the American people that we're making progress here. On the communication side, do you have specific actions you've taken or do you plan to take to get to the American people what the CDC is doing and why?
Well, thank you, Dr. Bouchon, for that. And yes, I hope you are already seeing the CDC communicate differently. First, we've overhauled our website where people do come, and there's more to come with that as we continue to consolidate the information so it's more usable, people can access it more quickly. But we're also communicating in different mechanisms. So, for example, when there was a new variant that we saw in August, we immediately put something out to say, here's what we're seeing, here's what we know, and here's what we don't know. I think that was brought up earlier. So we're trying to rapidly communicate, and we're trying to use different mechanisms to communicate. So we're trying to make sure that we are meeting folks where they're getting their information. They're not coming to our website necessarily for information. We have to go to where folks are, whether that's using social media or others. So you're seeing me post a lot more videos. So we recognize that some folks want to watch a short video to understand a complex topic. So I think there's a lot of ways in which we're changing up how we're communicating. But we're still going to make sure that we are focused on bringing the best evidence and data to that, but make sure that it's simple and timely, as well as work on the ground for real people.
Because as you know, as political people like ourselves, communications is key, and that has changed dramatically over the last 10 years, right? And if we're behind at an agency, you just don't reach most of the people. You have to be on social media. You have to do, to your point, go to where you reach people. I have adult children. None of them watch the regular news. None of them. They get alerts on their phone, whether that's on Snapchat, whether that's on Instagram, X, all of those, and I'm hopeful that we can do that. Who do you seek guidance on to help you do this? I mean, who's helping? Is it, I would argue that maybe it should be Madison Avenue.
Well, first, you can already follow me on Insta, but we have brought in, additional folks to make sure that we're modernizing how we're thinking about communication, and so I think we still have work to do, but yes, important.
Do you have an internal? Does the CDC have a robust internal communications and public relations department specifically to address this?
Yes, sir. We have a communications department. It's under new leadership. I think they're doing good work, but we're not all the way there. We have more work to do.
Okay, I appreciate that. And you're aware of the CSIS report on modern,
Oh, yeah, the
the
CSIS, yes, sir.
this report.
Yes, sir.
Yeah, there's a lot of good things in there. It was a bipartisan commission. I know that Dr. Walensky and I talked about that. We actually had a meeting over at CSIS here in town. Dr. Walensky was there. There's a lot of good ideas in there, bipartisan. I just encourage you to use this as a resource along with your internal moving forward program. Thank you.
Thank you.